Welcome to Stroger Hospital's training module number 8, the 10-step process for cleaning the occupied patient room and patient restroom.
At Stroger Hospital, we believe that thorough environmental cleaning and disinfection is crucial to the health and well-being of patients, guests, and staff. As such, it is vital to understand the importance of environmental cleaning and disinfection of patient rooms. Our goal is to remove the contamination of microorganisms from surfaces and equipment where patients receive care, in order to minimize the risk of disease transmission and cross-contamination. While we perform this important work, our goal as environmental service employees of Stroger Hospital is also to be ambassadors of Stroger Hospital to the patients, guests, and staff who are present while our work is being performed. Your role as an ambassador is especially important when you are cleaning the occupied patient room in the intensive care unit. We also refer to this patient care area of the hospital by the acronym, the ICU. As you perform your work in the ICU, be mindful of two important differences in how you approach your work as compared with how you service a standard patient room. First, be sensitive to the fact that patients in the ICU are under intensive care. As such, these patients are struggling with recovery from illnesses and serious medical conditions. Be patient and kind in all your interactions with ICU patients. Also, if you suspect there is a medical emergency unfolding for a patient in the room you are servicing, alert the medical staff immediately. Second, always be ready to clear out of the room if a medical emergency unfolds. You do not want yourself or any of your equipment to get in the way of the medical staff if they need to respond to an emergency patient need. In this training module, you will learn the 10-step process for patient room and patient restroom cleaning as follows. Number 1. Interaction with the ICU patients and guests, starting with saying hello. Number 2. Safely emptying waste containers and removing trash. Number 3. High and low dusting of the patient room. Number 4. Disinfecting surfaces. Number 5. Spot cleaning surfaces. Number 6. Cleaning and disinfecting the patient restroom. Number 7. Dust mopping the floor. Number 8. Performing final inspection of the patient room. Number 9. Damp mopping the floor. And number 10. Interacting with the patient before saying goodbye.
Before entering the patient room, remember the acronym AIDET plus P, which stands for A. Acknowledge the patient. I. Introduce yourself. D. Duration. Say approximately how long you will be working in the patient's room. E. Explanation. What you will be doing. T. Thank you. Express a sincere thank you to the patient and guests. And P. Promise to take care or report any concerns the patient or guest might have. Also, be sure that you have washed your hands and put on a clean, fresh pair of gloves. Always knock on the door and introduce yourself, walking through the script we have given you. Do not ask the patient, "How are you doing today?" but do make a good impression because you are an ambassador of the hospital.
Let's talk about positioning your cart. Start by positioning your cart properly, next to the patient room door opening, but do not block the doorway with your cart. Next, knock on the patient's room door and do so even if the door is already wide open. This is a polite way of announcing that you are coming in and also asking for permission to enter. Do not enter the room if the patient or one of the patient's guests ask you to wait. If you do not hear a response, knock again. If you still do not hear a response after the third knock, enter slowly, being careful to listen and look for the presence of the patient or one of the patient's guests in the room. If no one is in the room, you may begin your work under the assumption that the room is occupied, but that the patient is not present. Perhaps they are walking the hallway or undergoing therapy.
When placing the wet floor sign at the entrance to the room, be careful not to block or only minimally block the entrance to the room with the sign. The sign needs to be visible, but should not be right in the center pathway of the walking lane into the room.
When you present yourself to patients and guests, speak directly to them. Make eye contact and have a courteous demeanor and tone. Have a pleasant smile on your face. Remember that many of our patients may be struggling with difficult health issues, so it is not a good idea to ask, "How are you doing today?" Remember the acronym AIDET plus P. A. Acknowledge the patient and guest, speaking to them by name. Using the formal address Mr., Mrs., Miss, along with the last name is considered respectful and polite. I. Introduce yourself by name, first and last. D. Is for duration, and that means to let the patient and guests know that you will be working in the room for about 15 to 20 minutes. E. Explain by letting them know that you are from the Environmental Services Department of Stroger Hospital and that you are there to clean and disinfect their room. T. Stands for thank you. Be sure to say please and thank you often, and especially be certain to say thank you when you are finishing your work and leaving the patient's room. P is for promise. Your promise to the patient is to take care of any requests they might have that you can take care of yourself and that you are authorized to take care of yourself. Examples of such requests would be cleaning a surface or a spill, providing linens, moving a light piece of furniture, or turning on or off a light. Requests that you cannot take care of or are not authorized to take care of require you to promise the patient that you will report the request to someone who can. Examples of requests that you cannot and should not take care of yourself include giving medicine to a patient, giving food to a patient, moving a patient, or requests for repairs to the patient's room. These type of requests you can promise you will report to your supervisor on behalf of the patient. Always remember, as a member of the Stroger Environmental Services team, you are an ambassador for the hospital. You have only one chance to make a great impression. Always use it to do your best.
Before you begin cleaning any patient-occupied room, it is important to remember to put on the appropriate level of PPE before entering. Next, inspect the area before pulling out the waste liner. This is to determine which portion of the room needs special attention and to also gather loose trash and place it in the wastebasket. It is important that you keep biohazardous waste located in the red trash can with red liners separate from the regular waste. Never mix the two together.
If there is a large amount of waste in the receptacle, do not use hands or feet to compress trash. This is to prevent injury from loose sharps that may have improperly been disposed of. When pulling trash, gather trash liner edges and tie the liner closed. Lift waste liner slowly out of the receptacle, keeping it away from your body. Never let the trash liner filled with trash bump up against any part of your body while carrying it to the designated container. Before replacing the trash liner with a new clean liner, wipe the interior and exterior of the waste receptacle to disinfect and remove any spills, drips, smudges, or fingerprints.
Always start dusting by first doing high-level dusting, then work your way down. However, do not perform high dusting above the occupied bed of the patient or over the heads of any of the patient's guests. High dusting in these spots can be left until the room is cleaned and unoccupied between patient assignments. When high dusting, take the microfiber duster and the extension tool and dust shoulder height or higher in the area. Dust the walls, ceiling, vents, ledges, furniture, fixture vents, and the wall area around the vents. Dust windowsills, baseboards, and chair rails. Generally, you need to look for dust accumulation on any horizontal surfaces that can catch dust, and make sure that you thoroughly clean it off.
Sanitize all horizontal surfaces with an emphasis on what we call the high hand touch areas. High hand touch areas are surfaces that get a lot of hand traffic. If you look around the room, you can see what the high hand touch surfaces are. Examples include doorknobs, light switches, bed rails, chair rails, patient food tray tables, telephones, TV remotes, nurse call buttons, cabinet pull or push knobs, and counters. Sanitation or disinfection cleaning is accomplished by applying neutral disinfectant cleaner to the surface. Please remember, you must always allow for the necessary 10-minute wet dwell time for the disinfectant to kill germs. Apply the neutral disinfectant cleaner. Allow it to sit 10 minutes wet dwell time. Wipe clean using the appropriate wiper. Use a blue wiper when cleaning the patient room. Use an orange wiper when cleaning the patient restroom. Leave the surface in a clean and streak-free condition.
Now let's talk about spot cleaning all vertical surfaces. Vertical surfaces are areas such as walls, doors, door frames, and cabinets. Again, look for the places on vertical surfaces where dirt, germs, splashes, or smudges can accumulate, and focus cleaning attention on these places. Examples include walls near or around the waste can often can get splashes or spills. Door push plates or door frames are frequently touched by hands and can have smudges and fingerprints that need cleaning. Cabinet doors can also have fingerprints, smudges, and accumulate dirt. Spot clean vertical surfaces such as these using the neutral disinfectant cleaner and the appropriate wet dwell time to let the disinfectant kill microorganisms.
Cleaning the patient restroom. Prepare to clean the restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of the surfaces and fixtures in the restroom, make sure you are using the neutral disinfectant cleaner and orange microfiber wipers. Remember, orange for bathroom cleaning only, blue for room cleaning only. Remember, on all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow for the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with a paper towel to prevent streaks. Clean sinks and the other surrounding areas, such as the counter, the outside of the bowl, and piping under the sink. Make sure to spot clean all splash marks on the wall that may be adjacent to the sink, the toilet, and the shower. Clean the shower, starting at the top and working your way down, and being sure to scour the shower basin floor. Next, start disinfecting the toilet by first applying bowl cleaner into the bowl of the toilet and allowing it to sit 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilet, to both sides of the seat, and to all exterior surfaces of the toilet, again, allowing for the proper wet dwell time. Wipe all surfaces of the toilet down and leave it in a clean and streak-free condition. When cleaning the inside of the toilet bowl, use a Johnny mop to clean the inside and then replace the Johnny mop in its carry container. Note, do not use toilet bowl brush or Johnny mop on the outside of the toilet bowl or any other surfaces other than the inside of the toilet bowl. Remember to empty the bathroom waste can, taking all of the same precautions used in emptying patient room waste can. For example, do not compress the waste. Do not let the full waste basket you have pulled from the trash can bump up against any part of your body. Wipe the waste can clean and reline with a new clean liner.
Refill soap dispensers, hand towels, and toilet paper. First, stop. Remember, you have just cleaned the restroom. Your gloved hands are contaminated with microorganisms from the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves, wash your hands, and put on new clean gloves. Restock paper towels with the fold properly facing down so that the towels dispense as they are intended to. Refill the toilet paper dispenser. Make sure spare rolls are stocked in the room. Refill hand soap dispensers. Refill shower toiletries. Replenish bath towels, hand towels, washcloths, and other linens.
Dust mopping the floor. Always make sure you dust mop before damp mopping. This excludes instances of an obvious blood spill in the room, in which case it is appropriate to clean using the Stroger Hospital Protocol for Bloodborne Pathogen Cleaning as described in the Standard Operating Procedure and Training Module number 24. When dust mopping, make sure you work clockwise around the room and use an S stroke while keeping the leading edge moving forward. Be sure to move any furniture and dust mop underneath. Make sure you dust mop carefully in corners, along edges, and on the baseboards. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust to be lifted airborne into the indoor air environment.
Before damp mopping, take a moment to do a final inspection of your work and make sure you have not missed anything. This is the time to inspect curtains and look for stains or portions of the curtains that might need repair. Be sure to check the sharps container and arrange for its replacement if it is filled to capacity. Remember, sharps containers are sealed for your safety and the safety of everyone at Stroger Hospital. Never attempt to open a sharps container. Double check all soap and hand sanitizer dispensers to make sure they are properly refilled. The same final check should be made to all paper product dispensers and all towels and linens. It is important that you check door hardware and metal kick plates to make sure they have been properly cleaned. If any items in the room need repair or any lights are burned out, be sure to report this to your supervisor so a work order can be submitted to the Stroger Buildings and Grounds Department.
Damp mopping. Prepare to damp mop the floor by placing a second wet floor sign inside the room. You should have one wet floor sign outside of the room at the entrance and one in the room, with both being highly visible to minimize the risk of slips and falls. Begin damp mopping the floor, working around the room using an S stroke and paying a special attention to corners and baseboards. Make sure to move any furniture and mop underneath. Make sure you mop behind the doors. And if you find any spills or stains on the floor, on the baseboards, or in the corners or edges that you cannot remove, report these to your supervisor. Before reporting this, however, make sure you have made every effort to remove the spot, stain, or spill yourself.
Take one final look around the room and the restroom to make sure that you haven't left any of your tools or supplies behind. Let the patient and the patient's guests know that you are finished and thank them for allowing you into their room to do your work. Ask the patient and the guest if there is anything else that you can do for them, if it is something that you can do yourself and that you are authorized to do yourself. Fulfill the request. If it is a request that must be fulfilled by one of the Stroger medical staff or someone else, let the patient know that you will report this to the appropriate person or department on their behalf. In all things, show the patient that you sincerely care for them while they are here with us at Stroger Hospital. Be sure to say goodbye.
Thank you for participating in Stroger Hospital's Training Module number 8, the 10-step process for cleaning the occupied patient ICU room. If you have any questions, please be sure to ask your supervisor.